Hello, this is Dr. Do again. This video is on alphabetic list of problems. On letter O, I had started ocular diseases for previous couple videos, and today is going to continue from that ocular diseases. And I think I've mentioned surface diseases like the cornea, the conjunctiva, and also sclera, and some emergency situation with this circular diseases, and also mentioned about the lens diseases like cataracts or the nearsighted or the farsighted eyes and the vision. So I encourage you to see your eye doctors if you have vision lost the clarity of visions, and also I talk about the emergency situation, what kind of symptoms you need to see your doctors, either specialist, your primary care, or emergency, right away without delay. And today I'm going to talk about the structure, retina, back of the eye. I think I had a previous video on this retina diseases, I think, such as age-related macular degeneracy, and also some other macular reticulopathy associated with systemic disease, for example, the hypertensive reticulopathy or diabetic reticulopathy. But today I'm just going to just talk about what kind of retinal diseases. And first of all, let me just bring up the emergency situation. Regardless, for a patient, at the standpoint of patient, you do not know it's retina, you do not know it's lens, or it's a cornea, or whatever. But as long as you have those symptoms, like I mentioned before, decreased vision acuity, and or decrease the vision field, as you see narrowed, or you see the hemorrhage, or you foreign body or injury, or you feel you have the foreign body sensation, even though you do not know or not from your knowledge that there's some foreign body falling into your eye, but you have this foreign body sensation, or discharge and class or crusting, or yellow or green, whatever. So all of those abnormalities, see your physician or specialist or emergency as soon as possible to diagnose and to treat. So that's on top of that. So talk about the retina disease, what kind of the symptoms associated with this retina disease. If the retina, common diseases of this retina is kind of the fluid, for example, beneath the retina, there's some effusions. Like I think I had this video previously mentioned about this fluid, subretinal fluid. It could be, could occur in, of course, the pre-existing retinopathy, for example, diabetic retinopathy. But however, this subretinal fluid effusion could occur in normal health, regardless age, young or old. The cause usually is really without known causes, just have fluid, probably from the inflammation or infection, subtle, we do not know, then just suddenly develop or gradually develop the vision not clear. So if that's the case, if you find your vision not clear, then you need to see your physician to get it checked. So this is about the one of the symptoms. And also sometimes for older people with pre-existing hypertension or diabetes, you may have some other symptoms, like for example, the blood vessels supply the retina is clogged, either artery or vein. You feel the vision decrease, sometimes may or may not associate with the hemorrhage, but those sometimes even the symptoms really subtle, really not quite clear. But for those like people with risk factors I just mentioned, if you develop any abnormal vision acuity, you see obscure and glare, or feel the curtain falling off, any of those, just see your physician as soon as possible, regardless, like I said, whether it's curable or not curable, but the earlier the better. Because there's retina disease, if half detached retina can be saved probably, So that's the time is really critical. So if you find the symptoms, you go to your physician right away, use the buckle, whatever, or laser, whatever the procedure to nail the retina back to the layer of beneath. So then can save your vision, at least the partial, preserve your vision. But if it's late, if the whole retina or large area of retina detached, that's not curable. So that's just it's such a bad, sad situation. So the point is, if you have any risk factors, or if you have recently really the trauma severe, and a couple of days later develop this vision obscure, see your physician as soon as possible. So those for systemic disease elderly, so have this kind of retinal disease. And also there's another chronic, not acute, but can suddenly become worse. Those the age-related macular degeneration, AMD. It's quite common. I think you all know it, and the probably you do not feel it until one day you feel the vision distorted. You cannot see anything straight or clear. And then for those, if diagnosed early, then treat early. Because this is a progressive disease, it just depends on the risk factors and the age, and also how it's maintained preventively to slow the progress. So if this AMD from dry stage, which means just the drusen deposit, and also just the vision unclear, if not treated on time, and later on develop the wet stage, which means the neovascularization with new blood vessel growth, and those, like I mentioned before, those new blood vessels is not functional, normal blood vessels, and tend to fragile and bleeding. So if that's the case, it's really hard. It's wet stage. It's difficult to manage, to treat. But regardless, so for older people with or without systemic disease, if you have any vision change, or just do regular vision checkup, I think 1 or 2 years, depends on individual. Usually it's 1 or 2 years to see your eye doctor, to follow up with your physician or your eye doctor. And for those with systemic diseases like hypertension, diabetes, I think you on the day on your diagnosis, you need to see your eye doctor, and not today, but just the newly diagnosed hypertension or diabetes. Need to have a baseline eye exam and then follow up regularly to see the progress on those systemic disease, whether progress to the retinopathy. So this is about the back of the eyes, the retina, which is like the film of the camera. It's very important, and also because the structure is contain the neurons, and also it's on the back of the eyes, it's not easy to manage. But unless young people has unknown cause of those edema beneath the retina, usually it's self-limited. That's a good prognosis. However, some of them can recur or develop a serious problem. So the point is, take-home message is, if regardless your age, if you have any symptoms, decreased vision acuity, or eye pain, or discharge, crusting, or hemorrhage, or with or without systemic disease, or regardless of age, see your doctor, either primary care, your eye doctor, or emergency, to get it diagnosed and treated as soon as possible. So I'm going to stop here, and I hope the video helps. And thank you for watching. I will see you next time.